Hello and welcome to another episode of Ask a Nac Doc. I'm Jeff Patterson, Chief Executive Officer of Nacogdoches Medical Center, and today I'm here with Dr. Eddy Furniss. Welcome.
Thanks for having me.
Well, it's really good to have you here. I think most folks know Dr. Furniss as a Nacogdoches hometown guy. His dad was one of the founders here at Nacogdoches Medical Center almost 50 years ago. But as a primary care physician, family practitioner, you interact with so many folks on the front line. Tell me about your role as a primary care physician here in Nacogdoches.
It's nice to be back in my hometown, but I really came back to help the community and help our community thrive.
You know, we're real fortunate because doctors have brought their succession plan through their family, so I guess there's a lot of pressure on your kids.
I'll let them do what they want. You know, some of them want to be in finance, some of them want to be doctors. I just let them do what they want, and it turns out for the best.
What issues or what things do you see in healthcare that you think there's opportunity for improvement?
I think waste and avoid unnecessary care are the big focuses of my practice. One question you should ask your physician when they want to do a test or procedure or you're up for one is to say, is this really necessary? Just that one question can pause a physician and make them think about, well, here's your alternatives. What are the risks? What are the benefits? What happens if I do nothing? Some of those questions that you can ask, but remember that one question.
Some folks actually don't have a primary care, so as folks research a primary care provider as well as look at what screenings and tests they should be undertaking, can you give any advice there?
Primary care is incredibly important. A lot of people just like to use specialists, but primary care really should be your quarterback. And of course, it's the most cost-effective clinician in the health system. It's certainly undervalued in some ways, but can really help you and guide you. Some of the resources that you can use for, say, screening tests, like should I have my mammogram? How often should I have that? Colonoscopies and how often should I have those? Is the U.S. Preventive Task Force guidelines. That's where the most evidence-based, objective measures of what should happen at certain birthdays. For example, mammograms starting at 40, colonoscopy starting at 45 now rather than 50. If your family member had an advanced polyp in someone that you share half of your genetics, mom, dad, brothers, sisters, you should start at 40. There are certain things that you can do, but some resources, use your physicians, but also check for yourself on the U.S. Preventive Task Force guidelines.
We really show the importance of having a primary care provider. There's a lot of stuff in there I didn't even know, and that's one of the reasons we do these, Dr. Furniss. So thank you so much for joining us today, and thank you for joining us for another episode of Ask a Nac Doc.